Well, now that students are back in school, parents should be vigilant about viruses that could make their kids sick. And one of those that we've been following closely is RSV, and cases are once again on the rise. But the symptoms aren't quite as well known as the flu or even COVID. So here to talk more about it and how to keep your loved ones safe, we have Dr. Dustin Monroe, a pediatric critical care physician at the Valley Hospital in Ridgewood, New Jersey.
That's right.
Thanks so much for being here.
Oh, thank you for having me.
So we talked so much about this. We reported a lot on it last year, but there are still some people that might not know that much about it. So maybe we'll just kind of rewind, explain what RSV is and how it affects children in particular.
You know, entering into the fall and winter time, we're going to see a lot of cases of RSV, which stands for Respiratory Syncytial Virus. About 2 million office visits happen every year because of RSV, and 50 to 80,000 children are hospitalized, and a number of those are fairly severely affected, especially under 2 years of age, but more importantly, the less than 8-month-old children are the most affected by it.
Oh, it's just so sad when we see, you know, our children ill. And when there are symptoms, it's hard sometimes to compare between RSV, COVID, flu, other illnesses. So what are the specific RSV symptoms?
Okay. RSV ramps up over about 2 to 3 days. Kids start getting a little bit sicker with cough, congestion, runny nose. And on day 3 or 4, they can start having labored breathing. They can become dehydrated because they're breathing so fast. Mucus accumulates in the nasal passages and they have trouble breathing. They can get really dehydrated and have dangerously low oxygen levels as well.
And there is a vaccine for children. So when should they get it? Who should get it?
Yeah, so it's a brand new immunization, which is a little bit different than a vaccine. In a vaccine, you're given a protein that helps you make antibodies. In an immunization, which we have now, it actually conveys the antibody to the children directly. It's a passive immunization, and so they're protected. In the past, we can only protect kids for about 1 month. This new immunization lasts for about 5 months, or the entire RSV season, and it's available for children going into their first RSV season up to 8 months of age, and those going into their second season if they have other illnesses like cancer or they're immunocompromised in some way. So now's the time where we can start talking about providing that for families and for the children to protect them.
So you mentioned the immunization lasting through the whole season, so would that be considered quite effective?
That is much more effective. It's about 80% effective in keeping kids out of the hospital or preventing severe illness. There's also a vaccine available for older adults because it does affect the older population over 65. That's a vaccine that they can get. There's also a vaccine available for pregnant people who can get it and pass those antibodies to their children. And we recommend that somewhere between 30 and 36 weeks of pregnancy.
Now, if you do unfortunately have RSV, are there at-home treatments? What do you recommend people do, especially when they should seek professional help?
Yeah. First and foremost, you want to keep the nose clear. Get a good way to clean out that nostrils for the children. It helps them breathe a lot better, especially right before a feed. If you clean the nose out, it helps them hydrate a little bit easier. And then have some vigilance. If they start having labored breathing or they're in distress, seek out attention by a good, trusted pediatrician, or seek out emergency care at one of the emergency rooms, such as the emergency room at Valley Hospital, where we have a pediatric emergency room ready to go for children that are more severely affected.
Right. When in doubt, seek help. Dr. Monroe, thank you so much for all of those tips.